Greetings from Indian Journal of Anesthesia. I, Dr. Riniki Sharma, will be presenting an article published in the November 2024 issue of the Indian Journal of Anesthesia. It is titled Evaluating the Predictive Efficacy of the El-Ganzouri Risk Index for Difficult Laryngoscopy and Intubation with King's Vision Video Laryngoscope, a prospective cohort study. Airway management is crucial in anesthesiology, with difficult intubations accounting for 30 to 40% of the anesthesia-related deaths. The El-Ganzouri Risk Index predicts difficult intubation by assessing factors like mouth opening, thyromental distance, and Malampati classification, and it has been validated with traditional laryngoscopes like the Macintosh blade. Video laryngoscopes like glidoscopes and CMAC have been used with the El-Ganzouri Risk Index, and they have showed enhanced sensitivity and specificity in predicting difficult intubation. The King's Vision video laryngoscope provides clear glottic visualization without anatomical alignment and has options for use of both channeled and non-channeled blades. But challenges like blade insertion and tube placement remain. So this study aims to evaluate the efficacy of the El-Ganzouri Risk Index in predicting difficult laryngoscopy and intubation using the King's Vision video laryngoscope and comparing its predictive performance with other scoring systems. So the primary objective was the predictive efficacy of the El-Ganzouri Risk Index score for direct laryngoscopy and intubation, specifically assessing the relationship between the scores, view obtained, and the ease of intubation. The secondary objective was comparing the predictive performance of this score with other established scoring system. Ethical approval was taken and the trial was registered in CTRI, and it was a prospective observational study which included 18 to 69 years old patients with ASA grade 1 to 3 undergoing general anesthesia with endotracheal tube. Patients with evident airway anomalies like neck tumors or palatopharyngeal pathologies, pregnancy requiring fiber optic intubation, C-spine injury, unstable hemodynamics, and patients with active oral bleed were excluded from the study. So written informed consent was obtained and all patients underwent detailed preoperative evaluation. The El-Ganzouri Risk Index score was determined preoperatively, and if it was more than equal to 4, then it was identified as a high risk for difficult airway management. The bougie and difficult airway cart were kept ready. Inside the OT, the ASA standard monitors were connected to the patients, and after which the patients were pre-oxygenated with 100% oxygen for 3 minutes. Then they were pre-medicated with glycopyrrolate midazolam and was induced after giving muscle relaxant and inducing agent propofol. The patient was then ventilated with 100% oxygen with sevoflurane 1% maintenance for 3 minutes. Then the patients were kept in the sniffing position for direct laryngoscopy, which was followed by video laryngoscopy. Anesthetists who had a minimum of 3 years of clinical experience were part of this study. They assessed the laryngeal exposure with the Macintosh size 3 or size 4 blade and assigned the Cormack-Lahane grade. Then the intubation attempt was taken with a King Vision video laryngoscope, size 3 blade, and the percentage of glottic opening and Fremantle scoring system was done. So the primary outcome was the predictive efficacy of the El-Ganzouri Risk Index score for direct laryngoscopy and intubation, specifically assessing the relationship between these scores, the views obtained, and the ease of intubation. The secondary outcome were comparing the predictive performance of this score with other established scoring system, which is the Freemason scoring system in this study. The sample size was based on a previous study that found 93% sensitivity in predicting the difficult intubation with video laryngoscope using this El-Ganzouri Risk Index. they've had a 10% incidence of difficult intubation. Keeping these values in mind and to have a comparable 10% precision and 95% confidence interval, the sample size was found to be 250 and a p-value of less than 0.05 was considered significant. So this is the flow chart showing the preoperative assessment and patients included in the study. This is the baseline demographic data where this has been, the patients have been divided, 250 patients were divided into two. The low risk where the EGRI was less than 4 and the high risk where the EGRI was more than 4. And this is the baseline parameters between the two groups. After which difficult airway was assessed with different scores. It has been found that in a total of 71% patient, the CL grade was less than equal to 2A. And video laryngoscope had 100% glottic view in 64% of the cases. And using the intubation difficulty score, 70.4% had a total score of 0 and 2.4% patients had a total score of more than 5. Lower the IDS, easier is the intubation, and higher the IDS score, difficult is the intubation. So this is the ROC curve for Cormack-Lehane intubation difficulty score, POGO score, Fremantle view score, and Fremantle ease of intubation score. So the ROC cutoff of CL grade, POGO scoring for difficult intubation, Fremantle scoring for difficult view, and Fremantle scoring for difficulty in intubation, and IDS score of more than equal to 5 was found to be 3. So from this study, it was found that the El-Ganzouri risk index reliably predicted difficult tracheal intubation, especially when used with King Vision video laryngoscope, as higher EGRI scores correlated with increased IDS scores. Although the EGRI score was more effective in predicting ease of intubation than laryngoscopic view quality, this study emphasizes the need to assess these two factors independently. Consistent with prior research, video laryngoscopes like King Vision improved the glottic visualization and facilitated easier intubation compared to conventional laryngoscopes. However, the differences in EGRI's predictive power across video laryngoscope devices highlight the need for a standardized system for predicting intubation difficulty. And the single-centered, non-randomized design and absence of a control group limits the generalizability, which is the more major limitation of the study, and this necessitates larger multi-center study to validate these findings. So to conclude, this study demonstrates that the El-Ganzouri risk index effectively predicts difficult airways in patients intubated with King's Vision video laryngoscope. Thank you.